Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving. Today we're talking with Misti Bowers, Director of Hamilton Hospice. We're diving into an important but often misunderstood service, hospice care. Misti is here to help us understand what hospice is, who it is for, and how it can benefit patients and their families. Misti, I'm glad you're here. Welcome to the show.
Thank you for having me. I'm excited to talk about this important topic.
It is very important, and let's just jump right in. I've got some questions for you. One of the questions that everybody has is, can you tell us a little bit about Hamilton Hospice, what it is?
Sure. So Hamilton Hospice is part of Hamilton Medical Center at Vitruvian Health. We're a nonprofit service that provides end-of-life care for patients and their families throughout Northwest Georgia. So we actually were Georgia's first Medicare certified hospice agency over 40 years ago. We provide care for individuals in Whitfield County, Murray, Gordon, Catoosa, and Walker counties. The Hamilton Hospice team includes physicians, nurses, home health aides, social worker, and chaplain. And we also have volunteers. The care that this team gives focuses on living a good quality and meaningful life for all the time that we have left.
I understand. Exactly what is hospice for people who don't know what hospice is?
Yeah, so great question. It is hard to and difficult to understand. So hospice care is the health care that is received when someone decides they no longer want to receive aggressive treatment for a life-limiting disease. It's care that specializes in providing comfort and dignity and support to those patients and their families. Our families are involved in hospice tremendously. I mentioned our team members earlier. These folks provide care where the patients live, whether that be in their homes, with their family, or in assisted living or even long-term care. We treat the person and the symptoms that their disease is causing by managing those symptoms and distress. But we also, with those chaplain and social workers, work on any social and spiritual issues.
Who might need hospice care?
Hospice care is for anyone who has a terminal disease and whose physician would think they might have a life expectancy of 6 months or less if that disease was allowed to run its natural course. Those who need hospice care have made a very strong and dignified decision to stop aggressive treatment for their disease. These are often people who might have trouble performing daily tasks, who have frequent hospitalizations or emergency room visits, or just in general controlling symptoms like pain and shortness of breath that their disease is causing. But it's always a decision that's about focusing on the quality of life rather than continuing aggressive treatment.
Talking with Misti Bowers, Director at Hamilton Hospice, you talked about terminally ill. What does terminally ill mean in the context of hospice care?
So being terminally ill as it relates to hospice means that you have a serious disease or maybe multiple serious diseases that are expected to lead to the end of life because it's irreversible or incurable. Specifically in hospice, it means that our life expectancy would be 6 months or less if that disease ran its natural course without treatment.
Can you give us examples of illnesses that might qualify someone for hospice care?
Sure. So common serious illnesses that might qualify someone for hospice care would be maybe an advanced stage of cancer where curative treatment like chemotherapy or radiation are no longer effective. Heart disease, including heart failure, where symptoms like shortness of breath and an intolerance of activity are severe and don't respond to treatment. Lung diseases like COPD, so that's chronic obstructive pulmonary disease, where breathing difficulties are severe and for a lot of people are constant. You would also have Alzheimer's or Parkinson's disease that could qualify. So that's just a few. There are many others, but it's very important to remember that every patient and their disease process is different. The patient-centered and individualized care that hospice brings keeps in mind that we are all individuals and that care is surrounded by what that person needs. And we make sure that that plan of care is started when the time is right for that person.
Misti, thank you for joining us. It was great having you on the show, helping us understand the basics of hospice care. How can our listeners find out more about Hamilton Hospice?
Thank you for having me. Hamilton Hospice can be reached at 706-278-2848.
That's 706-278-2848, or you can visit vitruvianhealth.com/hospice for more information.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.